Okay, hello and welcome. I am Editor-in-Chief of the Journal of Dental Research, Dr. Nick Jakubovics from Newcastle University in the UK. And I'm joined today to discuss the JDR paper on the consensus statement on future directions for the behavioral and social sciences in oral health by Dr. Dan McNeil from West Virginia University in Morgantown, USA, and Dr. Cameron Randall from University of Washington in Seattle, USA. So Dan and Cameron, welcome and thanks for joining me. So the behavioral and social sciences are really central to understanding and addressing dental, oral and craniofacial health and diseases and other conditions right across the discipline of dentistry. And I think the consensus statement reflects the current state of knowledge in the behavioral and social oral health sciences and identifies some future priority areas for research. So perhaps you could start by telling us the motivation for developing a consensus like this.
Thank you for that kind introduction, Nick. It's exciting to talk with you about an initiative that we've been working on for the past 3 years and more. Over the past decade or so, it became obvious to us that there was high quality behavioral and social science research going on in various regions of the world, but it was siloed by national and regional boundaries. There was too little cross-fertilization of ideas and findings. And on top of that, other areas of dentistry were not truly capitalizing on the full inclusion of behavioral and social determinants of oral health and healthcare, and not really incorporating state-of-the-art methods that were available in the social and behavioral sciences. As someone who's worked in this area for my entire career, I've had the advantage of seeing the evolution of behavioral and social sciences in dentistry over time. We truly are standing on the shoulders of giants in the field who came before us, who ushered in an era in which behavioral and social sciences became recognized and included in dentistry. Now we're the champions for inclusion of the most contemporary ideas and approaches that we bring in from basic social and behavioral science fields. And we're inviting and encouraging a new generation of researchers from all disciplines, from periodontics to oral surgery to restorative dentistry and others, to fully engage and include the most contemporary behavioral and social science theories and methods in an evidence-based way.
Too, I'm grateful for the introduction, Nick, as well as this opportunity to talk about the consensus statement. You know, thinking about what motivated us to do this, as Dan mentioned, formal work on the initiative began about 3 years ago, but countless discussions over the several years before that led to our decision to begin leading this project. And back then, I was working with Dan as a graduate student, and we frequently and I think quite passionately talked about all the observations Dan just listed. In following the literature and in hearing work presented at conferences and in talking with colleagues, we saw so many opportunities for greater, more rigorous, and more comprehensive application of the behavioral and social sciences to dental and oral health research. And coinciding with these discussions, there seemed to be increasing understanding and appreciation of the role of social determinants of behaviors and health, not just among the people doing behavioral and social research specifically, but also among the broader dental and oral health research community. So the timing was right. You know, in addition, I was an eager early career researcher then, often thinking about the future, and I longed to see more translation of the great existing epidemiological and etiological research, as well as more scaling up of high quality intervention work that's out there. We know so much about the role of behavioral and social factors in oral health, but was that knowledge maximally benefiting patients and communities? And Dan supported this sort of thinking, and the result is a project that has a future-oriented and action-oriented vision, I think.
Well, fantastic, thanks. It's really interesting to hear that background. So, and what roles do the behavioural and social sciences then play in oral health? And Cameron, perhaps you can start with this one.
Sure, it's a great question, Nick. Behavioral and social factors play a significant, complex, and far-reaching role in oral health, just as they do in other aspects of health. Most simply, many of the dental and oral health problems researchers and clinicians address, the same ones that have numerous consequences for our patients and communities, are in large part a function of behavior. For instance, preventive behaviors like flossing, brushing, use of fluoride products, and regular visits to the dentist typically come to mind. But there's also diet, use of substances such as tobacco products, helping others like our children or elders complete oral hygiene routines, and many others. These behaviors are driven by psychological processes like knowledge and attitudes and decision-making and emotion and motivation. And importantly, social factors such as family or community norms, oppression, access to healthcare, and governmental or other policy have major influences on these behaviors. As such, and because behavioral and social factors are so critical to oral health, the behavioral and social sciences have a key role in oral health research and practice, and they must be applied if we are to improve oral health for all. And I'll make one more comment on this. The behavioral and social sciences are uniquely positioned to identify and achieve racial, cultural, and other equity in oral health. In addition, the behavioral and social sciences can be tapped to improve education and training of the dental workforce, oral health policy making, and the dissemination and implementation of new discoveries and associated clinical recommendations. So they really are central to oral health and the work that we're doing.
Thank you. So clearly you've shown us how important it is to integrate the behavioral and social sciences, but how do you go about achieving such a wide international collaboration and consensus among scientists from really right across the globe? And so I'll direct this one to Dan.
Thanks, Nick. Well, first, I ensured that my former student, friend, and current collaborator, Dr. Cameron Randall, was willing to partner with me in this endeavor. Cameron brought tremendous expertise and new ideas and made the work very enjoyable. We used our professional networks in IADR, and particularly our leadership role in IADR's Behavioral, Epidemiologic, and Health Services Research Scientific Group, or BEHSR, to begin what became a truly global collaborative process. I was president of BEHSR when we formally began the project, and that presented an opportunity to use the platform and support of BEHSR to assemble and coordinate an international behavioral and social science. There are too many to mention here individually, but they all are authors on our JDR consensus statement paper, and I'm incredibly grateful to each one of them. Together with the steering committee, we organized and led the Behavioral and Social Oral Health Sciences Summit, a 3-day virtual meeting of over 400 oral health stakeholders, researchers, and clinicians with expertise in the behavioral and social sciences. And that meeting took place in late 2020. It was the first ever international meeting of its kind, though there had been national meetings at various times over the years. And the summit served as a launch point for promoting oral health globally by advancing the robust application of behavioral and social sciences. It built consensus among health scientists and clinicians about essential foci in critical next steps. We asked for and encouraged feedback on drafts of the consensus statement, which was iteratively developed over time after the summit, and then we invited endorsements. The most important aspect of the consensus statement is forward-looking. having a direction for how we should fashion the future and what actions are needed.
Well, fantastic. And I think it's a real model for how you can build a consensus in a field like this. Now, you mentioned that the aim of the consensus statement was to advance oral health research by ensuring the full inclusion of the behavioral and social sciences and social factors in all areas really of dental research, and to apply the strongest and the most contemporary methods. So to that end, the statement identifies priority areas, and as you say, the forward-looking facet of the statement is one of the most important aspects. So can you just tell us a little bit about some of the priority areas that you've identified for future work?
Sure. There were 4 major areas identified, and then an overarching concept as well. The first and critical need is the development of contemporary multi-level theories and models that can guide our research efforts, and also our ways of thinking and conceptualizing oral health and healthcare. We need to focus on the various mechanisms involved in oral health outcomes and not assume that there are single mechanisms in play, thinking too about causal relations. In the same theory, we need to include the broad social determinants of behavior in oral health outcomes and the individual behaviors of dental patients, the public, oral healthcare providers, government officials, and policymakers, among many others. And these theories must be broadly inclusive to forthrightly include issues that affect marginalized, oppressed, and underserved groups in society. A second area is that of methods. We need to develop and agree upon gold standard methods and fully utilize not only quantitative, but also qualitative and mixed methods approaches. Causal analysis, complex system science, and community engaged research all will be essential components of our future research efforts.
So the third area is the development and testing of behavioral and social interventions to promote oral health. We must focus on both individual and population level interventions, ones that are scalable yet can be tailored to individuals and systems, and ones that specifically target marginalized and underserved groups. Future intervention research should be theory informed, utilize contemporary rigorous methods, and involve new technology as appropriate. It should also include co-development via stakeholder involvement at all stages of the research process. And then that fourth area that Dan mentioned is dissemination and implementation research. There is much opportunity to apply dissemination and implementation science to improve oral health. That work, we believe, should adopt contemporary dissemination and implementation study designs, strategies, and outcome assessment. And it should be multidisciplinary with a focus on contextual factors and a goal of informing public health and policy approaches that support upstream action and a commitment to equity. Additionally, the consensus statement includes a few overarching considerations, such as integrating the behavioral and social sciences in the education and mentoring of oral health clinicians and researchers, adopting or enhancing multidisciplinary collaborations, focusing on inclusive research, and including positive aspects of oral health in future work.
Okay, thank you. So what impact do you think the consensus statement is going to have, and what are the next steps?
Thank you, Nick. We've reached consensus, which is wonderful, and over 400 groups and individuals have endorsed the consensus statement. That list is included as an online appendix with the JDR article and still is growing. Now our most important focus is how to drive future research and how to translate our findings to dental and health services education, health sciences education, to impact community programs and partners, and to affect policy with our research findings. We need to continue to develop relevant theory and to utilize state-of-the-art methods. Our science will be more fully realized and our patients and the public better served as we further integrate and translate behavioral and social sciences into oral health research, oral health promotion and healthcare, and the training of those working to ensure oral health for all.
That's right. And we're hoping folks take up the charge outlined in the consensus statement to advance the field across these identified areas of focus. And we're hoping the global community of people doing that work is broad, interdisciplinary, and diverse. Everyone is encouraged to get involved in this critical work.
Okay, well, thank you so much for joining me and for sharing these additional insights with us. The important consensus statement article is going to be published alongside two key perspective articles, one of which will highlight racism and oppression in oral health, and the other will talk about the importance of building transdisciplinary teams to address some of the really complex issues that we as oral health researchers face in trying to improve oral health and reduce disease worldwide. So the consensus statement article itself and the two perspectives are all published together in the journal, and you can find them through the links below this video recording. So thank you very much for joining us.
Thank you.
Thank you, Nick, for this wonderful opportunity to highlight the importance of behavioral and social sciences in oral health.